I'm Marlon Moraes and I am the GP HIV champion for the City of Manchester. In Manchester we have a problem with late diagnosis of HIV, and this is partly due to the fact we are probably not testing enough patients. When we look at many disease areas, the majority of the referrals into secondary care come from general practice. So if we look at diabetes, if we look at even hepatitis, heart disease, then we find out that most of the referrals come from primary care. Unfortunately, around 90% of the referrals to the HIV services come from other sources other than primary care. HIV testing is easy to do. There is no longer a need for the pre-test counselling that we used to have to do many years ago. In the past, HIV was a different diagnosis to it is now. Therefore, there was this need for this pre-test counselling that we used to have to give patients. These days, HIV is very treatable. It leads to as normal a life expectancy as many other long-term conditions. And once treated, it is not transmittable. A HIV test is easy to do in your surgery, a simple blood test. We may even be doing blood tests for other reasons, and just always think, do I need to do a HIV test for this as well? There is a long list of indicator conditions which we are aware of, and for those we should be doing a HIV test in the same way we would do a test for liver function test or for diabetes. So once we've done this test, we obviously wait for our results. If this result comes back as positive, with HIV, we actually have a much better support mechanism than we have for many other diagnoses that we give in a surgery. There are easy referral mechanisms into the HIV clinic, and the patient will be seen within 48 hours. And also, there's an easy referral mechanism to get the extra support for the patient from the George House Trust.
George House Trust provides advice, support and advocacy for people living with HIV, and we do that through a number of key ways. Firstly, we provide one-to-one services. So that could be an appointment with somebody like myself, a services advisor, and we can deal with issues such as knowledge and understanding of HIV, how that might impact people's sex and relationships, their emotional well-being, their adherence to medication, things of that nature. We also offer a counselling service that provides, as standard, 12 sessions of person-centred counselling. There is a bit of a waiting list, but not as long as it would be if you were making a referral to, for instance, CBT in the NHS. We have a peer mentor service that provides social and emotional and psychological support to people who are trying to come to terms with some aspect of the HIV diagnosis or the impacts that might have on some areas of their life.
Once referred into George House Trust, that patient will receive more support, more advice and signposting than we would ever have the time to do in a 10-minute appointment in our surgery. So there's less fear about doing the test in our surgery because we have such a great support mechanism for a positive test. So please, do a test.
My name's Jed. I'm HIV positive. I was diagnosed in 2002. I'm a straight male. Becoming more confident with my condition, especially after U equals U and doing the positive speaking. A lot of talks have been at schools with doctors, surgeries, nurses, stuff like that. So it's really empowering standing there and just saying, my name's Jed and I'm HIV positive. So it's really beneficial for me, as well as hopefully educating the audience a little bit. I don't go to the doctors too often, so I normally see locums. They tend to be fairly knowledgeable about HIV and U equals U. which is when you're on medication you can't transmit the virus. So they're knowledgeable about that, but maybe not so much the live part of it. Actually living with HIV and the issues around telling people your status, especially if you're dating, which is a massive thing in most people's lives. So yeah, on that side of it, I think they could probably be a little bit more educated on it, but the knowledge is good. I'd like to say to them, you know, I'm no different than anyone else. In fact, I'm less of a threat than other people. I know my status. Most people walking on the street don't. And the big thing for me has always been the stigma attached to HIV and my perception about what people think about it, which can often be wrong as well. It was, I'm sure if I told them I was a gay man and I was having risky sex, I'm sure they would have given me a HIV test, but they just presume because you're straight, one, that you're not going to have any kind of risky sex, and two, you're less likely to catch it.
You can make a referral to George House Trust by going to ght.org.uk/referral. Alternatively, if you would like to talk about somebody that you would like to refer to us, you can give us a call on 0161 274 4499 and just ask to speak to an advisor like myself.